Now we move on the national stage. The National Hepatitis Elimination Plan, and we need to act now. And Professor Huma Qureshi will also be touching on the PC1 of the Hepatitis Elimination Program in Pakistan. Huma.
So, thank you very much. Asad, you gave me 2 talks and you're giving me 15 minutes. That's cheating. So anyway, I'll go very quickly. So the need to act now, this is what I'm going to show you. Why is it not moving? Okay. So this is when we had very patchy data in 1999. The world map shows that Pakistan has a low prevalence of hepatitis C. But then we undertook this survey in 2005, which was published in 2008. And after the publication of this survey, you see the world map where Pakistan now appears as a country with the highest prevalence. And this is what you see, that Pakistan has the second highest hepatitis C burden in the world. Then Punjab did another survey in 2018 and Sindh did the survey of hepatitis in 2019. And as these two provinces comprise almost 80% of the population, so now our new prevalence has gone up from previous 5% to 7.5%, and probably now we might be the highest hep C burden country in the world. So these are the 2030 WHO targets, and it says that for the elimination of hepatitis, the incidence has to go down by 90% and the mortality to reduce by 65%. And then they're using 5 core interventions to see the coverage and the impact that is to be done using these core indicators. So I'll not touch the B part, but I'll just show you the testing and treatment for hepatitis. And they say that 90% of those who are diagnosed should be diagnosed, and 80% of those who are diagnosed should be put to treatment. So let's see what is here in Pakistan. We started collecting this data from the National Hepatitis Prime Minister's Program, which was launched in 2005. And then the data was being collected from there, and then following the evolution, now we have the Chief Minister's Program in all the provinces, and they were launched in 2010 and they're still there. So all the public sector data is collected from the hepatitis program. And as we know that 40% of the healthcare is provided by the public sector and 60% by the private sector. So we have used the 40% data of the public sector and kind of use the 60% as the proxy indicator for the private sector data. And then, we calculated the numbers that we have treated over these last many years, and then we put these up to the CDA, the Center of Data Analysis with Homi Razavi, and we kind of put it to them to kind of help us out that whether we are on the track of elimination of hepatitis C or we need to do more. So this is what Homi Razavi gave us, that he showed us the prevalence of hep C in Punjab 8.9, in Sindh it's 6.2, and there are about almost 5.7 million people who need to be treated in Punjab, and there are 2 million people who need to be treated in Sindh. So this makes almost about 7 million people who need to be treated in these two large provinces. And by the way, we have 9.7 million people who have the virus and who need treatment. And if we look backwards from 2017 to 2020, how many patients we have diagnosed and how many we have treated. So our best year was 2018, where we diagnosed 400,000 people and treated almost 353,000 people. So using these numbers, the Homi Razavi calculated the cascade of care for Pakistan for 2020, and they showed that of the 9.8 million viremic patients that are expected to be there in Pakistan, so far we have only diagnosed 22%, and out of this 22%, only 2% have been put to treatment. So there's a huge gap between the diagnosis and the treatment. But the good thing is that once you put them to treatment, almost 96% of them are cured with the treatment. So Homi Razavi said that if we continue with whatever we are doing, we would not be able to achieve the WHO targets, and that is what you see at the lower bars, that there would be no reduction in the infections, and the cancer reduction would also not be there, and the treatment coverage would not be achieved. So there was a need to act now. So we developed a national hepatitis C elimination program, and we calculated the numbers that are to be screened, tested and treated for each province, and even we went down to the district and the tehsil level. So we have these numbers for each province, tehsil and the districts. We have done costing for each activity for each province. We have done the modeling by CDA, and we have compared and found out the gaps that were there within our program and the CDA. We have developed national hepatitis C testing and treatment guidelines. The prices in the DAs have been drastically reduced, and they have been made affordable. Until the program is not launched, the provinces are doing their bit of work, and many of us are doing the micro eliminations of hepatitis C in different communities and in different setups. So now I'll just show you a few slides of the national program, which was developed in May 2021. So this is the prevalence of Hep C, and you see as of 2022 it's 7.4%, and if we don't do anything, then it's going to reach almost 8% by or to 9% by 2030. So it's going to gradually go up. So the level of intervention that we have put in the program is that it starts from the national level and then goes down to the provincial level, and then further trickles down to the district and the tehsil levels. So it's divided into two phases, and in the first phase we are going to screen 69 million people and undertake PCR of 5 million people and treat 4.1 million people. And then we have also calculated how many people would have no fibrosis and would need 12 weeks of treatment, and how many would have cirrhosis and might need a longer duration of therapy. And in the next phase, 1.2 million people will be screened, tested and treated. So these are the numbers that we have calculated for each province, how many population, how many positive, and how many would need treatment. So this is the resource input, that how many trainings have to be done, what type of training, where, how many people would be used, how many days. So we have calculated frankly everything for the training and for starting the program. And then the data flow is that, you collect the data from the household site, and even at the screening site, you go to the laboratory, you go to the treatment sites, and then all this data goes to the national dashboard, then to the provincial dashboard, and then the district dashboards. These are the costings for the different items, the drugs, the medicines, the diagnostics, the communications and everything for all the provinces and for all the years till 2030. So basically, by and large, this is the costing, and about almost 93% of the cost goes into the diagnostics and the treatments. And this is the financial bits, that how much money is to be put into each province. So we have all this data available with us. And then once we put this action, this plan into action, all the indicators of the WHO that you see here would be addressed, and we would be able to monitor and see the progress in our HCV elimination. And this is what Homi Razavi has shown, that with these numbers that we are planning in the national program, by 2030 we should be able to achieve all the 4 targets of WHO if we do what we have committed. And not only this, we would also be able to avert almost 353,000 cumulative disability adjusted life years by 2030. So this is what we have developed, the national hepatitis treatment guidelines, which have been made very simple. These are to be used by the general practitioners, the hepatitis control program managers, the nurses and the paramedics, and we need complete decentralization of testing and treatment. And we undertake the same day rapid testing followed by reflex blood testing for PCR and CBC, so that we don't lose the patients. So summary is that, ladies and gentlemen, we need to screen almost 19 million people every year, which is 8 times the current numbers that we are doing. We need to treat 1 million people, which is again 8 times the current numbers that we are doing. And we need to reduce infections, which is 10 times the current numbers that we are kind of right now controlling. So with the current pace, the HCV elimination appears impossible. There's a need to invest in the National Hepatitis C Elimination Program to save people and reduce long-term cost of complications and liver transplants, which we all know consume a large chunk of our hospital budgets. Provinces need to invest 8 times the current budget to achieve HCV elimination, and we need people to come out and get tested. But what I know, together we can achieve HCV elimination. Thank you very much.
Okay.